Thanks everyone. Ridwan from Life Healthcare does send his apologies. He had to pull out at the last minute. But I think firstly, we've done the introductions, but I think the two gentlemen to the left of me are some of the most inspirational people I've met in the healthcare industry. I came across Dr. Whelan or started interacting with him a lot during COVID. He started calming down the nerves of Nedbank. He gave a few talks to the whole of Nedbank about COVID and put some data out that ensured that we'd be able to get back into the office at some stage. So we appreciate that. And Vuyani is probably one of the most inspirational entrepreneurs that I've come across. I think when I first met you, you were on the infancy of growing the business, and a couple of years later, it's much more bigger than I think anyone could have imagined. So I think appreciate the time that you guys have spent with us. I think the topic of the conversation was, what are our options? I don't know if our options are different at the start of the week versus today, but I'm gonna dive straight into it and sort of ask the question in a bit of a roundabout way. But the NHI, a bill has been signed now. How are you guys thinking about the future of healthcare within this construct? I'll give it to you first, Ron.
Yeah, thanks, Avi. And thanks to Barry for all of the facts and figures there. It's always useful getting the facts and figures, and we really got to focus on the facts right now because there's a lot of noise in the environment. I think, simply put, nothing changes. Certainly there is a long pathway towards implementation, with many hurdles around the implementation, notwithstanding the funding hurdles that Barry spoke about. We've got to raise 200 billion rand. Barry said, that's got to come off a small and narrow tax base. So that's the first hurdle. Secondly, we've got to get it implemented. And I like to tell the story. Across Discovery Health, we administer benefits for 3.5 million lives. 3.5 million lives. We employ 5,000 people to administer benefits for 3.5 million lives. We've built systems over the last 30 years. I don't envy the person who has to run NHI and has to administer benefits for 60 million lives. You scale that up, that's somewhere around 15 times the capacity we've got at Discovery Health. That's a workforce of, call it 65 to 75,000 people. Long way off. And I think there are obviously a range of legal challenges and constitutional challenges, but Barry alluded to those. But I think what's important to point out, and why we say nothing changes, is in the NHI Act, as it stands now, is a Section 33, which is really the complicating part of the Act. And Section 33 states, when the NHI is fully implemented, nowhere in the Act does it define what fully implemented means. Nowhere in the Act does it define when fully implemented happens. Then goes on to say medical schemes will only be able to provide complementary cover for services not covered by the NHI. Well, then the question to ask is, what services will be covered by the NHI, and what will be the extent of those services? And against the funding constraints, we think at best there will be a minimum package of services, which means that medical schemes will have to provide the complementary benefits on top of that. So when you stack those things up, the funding challenges, the implementation challenges, the legal challenges, the provision in Section 33, we're confident and comfortable that medical schemes are not going anywhere for the long term, if ever. And therefore it's business as usual for us. And we've got our heads down on continuing to provide great products and services for our clients. At the same time, we're focused on doing what we need to do to make sure that we come out in the right place in relation to NHI.
And I think, Ron, Discovery has been at the forefront of innovation, I think, over the longest time. So whatever happens in the future, we trust that the medical schemes will be well placed to deal with it. Vuyani, I'm going to hand over to you. Any differing thoughts on NHI, or can we just tell everyone that it's not going to happen?
Not at all. I do think, though, that I think we're in all agreement that something must change in healthcare. right? I think we cannot continue with the status quo. And so I was always interested in while everybody is worried about their pockets, there are people who continue to exist who do not have access to healthcare. So what happens in the interim? And I think that's a conversation that hasn't been elevated. And I think the work that we're trying to do as Curo Medical is to try and bring about that necessary transformation, delivering that healthcare by, frankly, I mean, if we are honest, we're partnering with the very same people, Discoveries of this world, the LendMeds, the Life Healthcares of this world, to actually put together and even enhance a healthcare delivery model that can be sustainable and actually make the goals of the NHI and how that healthcare is delivered more tangible and realizable, right? And I think there's an urgency for us to get there. I don't think that. I think we should definitely leave with a peace of mind that nothing's going to change. But I also think we need to sit with the discomfort that Barry had presented earlier on, that there are people in this country that continue to live on just 50 rands, right, a day. And I think that from our side, there are concerted efforts to see how do we work with what we have, right? How do we work with the human resource shortages? How do we leverage technology to harness where patients are being treated, where there are limited capacities in facilities? How do we potentially convert some of the at-home spaces, which is where we're at, so that we can deliver the care? How do we leverage technology to engage in task shifting and task sharing? How do we drive down the cost of care so that we can redirect some of those to areas where we can have that value? All of those things can be done as we wait, right? Because there's an urgency in transforming healthcare. So I agree with you that while for most parts it has to be business, it will probably be business as usual and nothing's going to shift. But I do think that business as usual should make us very, very uncomfortable.
And I think that's wonderful points made, Vuyani, and I think you can hear the sort of passion in your voice and what you've achieved so far. So kudos to you for delivering that to us. I think it's a good way to get into this conversation, Ron, just around the ability of medical schemes to bring more people into the private sector, more people's onto a discovery. It's something that I've heard you talk about a lot, extending care, and obviously from a business perspective, it makes sense because you want to grow the pool. Could you talk about some of the things that you are looking at over the next 5 to 10 years to grow that discovery patient base?
Well, I think there are two sides to the equation on this, and Vuyani is exactly right in that there are new delivery models available globally, premised on the back of lots of digital technology that allow us to do some amazing stuff. We can increase access, we can reduce cost, and we can deliver care at the same quality. And Vuyani and team do this through Curo and their hospital at home model. We're in the hospital at home space as well. And hospital at home's a very good example of how you can use sophisticated technology to increase access to care, reduce costs, and deliver the same quality. In fact, in some instances, higher quality care. And we've got to be thinking about how we reform the delivery side of our system to enable a more efficient cost of care and increased access to care. Another example I like to cite on that front, imagine right now across South Africa, we can put a doctor into every single public clinic within the next few months. We could do it easily, simply. We have telemedicine, right? Quickly, doctor into every clinic, everyone has access to a doctor, a nurse is on site supporting that doctor in physical. It's a simple basket of medication. That feels to me like universal access to care. Yeah. And to Vuyani's point, that's called task shifting, task sharing, low cost delivery model. We can do that. That's some of the things that we can do on the supply side, and we've got to think more creatively and deliberately around how we reduce the cost of care, improve access to care. I think the second part of the equation then is on the financing part of the equation, and what's I think both exciting and frustrating for us at Discovery is that there are ways to bring somewhere between 7 and 8 million employed lives into the insurance market and into the private healthcare sector. So were we to pass the low-cost benefit regulations, which are currently sitting on the minister's desk and have been in development for many, many years, at the stroke of a pen, we could provide access to 7, 8 million people across a primary care benefit package. Isn't that wonderful? And by the way, bringing low-cost benefit options into the medical schemes environment allows those individuals to gain access to the medical scheme tax credit. And the medical scheme tax credit just so happens to fund most of the contributions on a low-cost benefit option. So effectively, it becomes free cover provided by the state where people are accessing care in the private sector. We can do this in months. We can do the doctor in a clinic in months. So these things are at our fingertips, on our doorstep, things we can do. And as Discovery Health, we are pushing hard on both fronts. Both on delivery models that reduce the cost of care, provide same quality of care, and driving for regulatory reform that allows us to bring a bigger cross-section of the population into the private healthcare sector. There's one additional benefit of doing that, and Avi, I know you said it's about growing our business. It's not. It's about increasing access to care. You take 8 million people who currently have to access care to the public sector and you bring them into the private sector, you decompress the public sector. So these are the things that we'd like to see manifest in the environment at a rapid rate of Watson. And I agree with Buyani, we don't accept business as usual. We want to move quickly,
Okay. I think that delivery of care, I think, is a crucial point, and I think that's where, Buyani, you can come in. Talk us through a little bit of what Curo Medical wants to do, where they see the future, specifically in the at-home care, and potentially tie it into what it could mean for the greater healthcare system.
No, absolutely. No, thank you. And I think the healthcare delivery model was summarized really, really nicely by Ron. I think so for those of you that don't know, we are a digital health company, and we are known in the market for a number of innovative solutions, leveraging technology to make care more efficient and more accessible and more affordable to patients. While a lot of our patients are in the private sector, we're really lucky to have partnered, for example, with healthcare funders that are very progressive in their thinking. We're very excited, for example, when Discovery Health announced that hospital at home would be a DSP for 8 conditions across 3 plans, within the country, which is again a game changer for us and our healthcare system more broadly. What this means effectively is that for a subset of conditions, you've got patients who, instead of being seen in a traditional brick and mortar facility at great expense and at great, clinical outcomes and cost, these patients can now be treated at home. It turns out you don't actually need to be physically present and admitted into a hospital bed for you to get the care that you need. And you don't need to be there to get the clinical oversight that informs the care that you need. And so, if anything, actually, the in-hospital environment, and I'm really sorry, Mark, but the in-hospital environment doesn't necessarily kind of encourage patients to be mobile, right? It encourages them to be sitting in the bed, and even if you're accessing physiotherapy, you get a physio for 1 hour and then you spend the rest of the day waiting for the physio to come around again, right? Whereas when you're at home, and we know that patients moving around and being in an environment that is most familiar to them actually contributes to their recovery, right? The food is even better, right? The cost is better, right? But most importantly for me, there's a significant shift actually in the power dynamic in the patient-doctor relationship, in that, and we've seen this, right? You walk into a patient's home, you suddenly you don't command a very paternalistic type approach. You are forced to have the family members to engage in that, and we've seen patients recover significantly. But also we've seen the impact on costs, right? It turns out that if you don't put a patient in an environment where there are 5 different doctors trying to deliver different value for the same patients for the same condition, you can drive down those costs by simply removing those patients from that area and putting them in the home. So we've seen a decline in the cost of, for example, of the number of providers. A similar example for those of you who are not in the medical field. For example, if you are a woman with, let's say, severe abdominal pain and you end up in a hospital, it is often the case that, you'll be seen by a number of treating providers, right? You'll have a physician to look after you, have a surgeon who'll come and assess you for an acute abdomen. They might bring in a gynecologist. You'll be scanned by a radiologist and all those things. And then at the end of the entire process, you leave with a simple diagnosis: urinary tract infection, discharge, here's your medication, right? And I think there's a way in which we can do that, give you the access to care, get to the right kind of diagnosis while lowering cost, right? And we've seen that. And then people, for example, worried about things like, but what about electricity? We've been delivering this thing for the past 4 years. Load shedding hasn't actually had a significant impact. But what if my patient complicates while they're at home? Well, we actually monitor patients leveraging real-time vital sign monitoring technology that transmits the information to a 24-hour command center that is run by qualified healthcare professionals. We've got background algorithms that are able to predict clinical deterioration, which means we are able to intervene on these patients much faster than they can if you're actually sitting in a traditional brick and mortar facility. So a lot of this is really sitting around perception. And then the last thing, which has been a big win for us, is that we always said, look, the doctor is involved in your care, right? We shouldn't be paying doctors for their presence by the patient's bedside. We should be reimbursing them, right, for the value that they're creating, irrespective of the location. So whether that is traditions, the clinical insight, and all those things. So if they're doing it by the patient's bedside or virtually, reimburse them. Again, progressive thinking organizations have been able to structure that to ensure that when your doctor refers you to the hospital at home program, not only do you have access to all the things that you normally get in the hospital, you have access to your doctor and they are reimbursed. You have access to medication, to real-time monitoring, the nursing care that you need. You need physio, you've got that too, right? So we've taken all the essential elements of in-hospital care, we've brought it to an environment that is most familiar to you, that is probably designed to deliver even better outcomes for you, and all of that at a fraction of the cost of what we need, right? This doesn't mean that hospitals don't have their play. I think what we can do, or rather what we're trying to promote, is how do we get the right patient being treated in the right setting, at the right price, for the right duration. And we cannot do that absent the introduction of, for example, novel and interesting and innovative models that can redirect patients from, for example, traditional models of care into an environment where they can actually generate that value. Now, we cannot do that in the absence of good funding models. And I think what DH has done, what MedScheme and its partners have done, I mean, we've got close to 90% of the medical schemes that are currently reimbursed, and therefore those members can access our services, right? Which again just goes to speak about how progressive the funders are, right? A lot of people were, scared that we get a lot of backlash and pushback from the hospital groups. Actually, quite the contrary, right? We've seen We've seen private hospital groups coming to collaborate with us just on this and finding out how do we make the system, a lot more efficient? Where do we potentially tap into? How do we, make it see the transition of patients from facilities into your care as seamless as possible? How do we get patients from your system back into traditional, brick and mortar facilities a lot more seamless? All the meanwhile, I guess, putting the patient in the center, and most important for me, unlocking the kind of costs and savings, rather, so that care can be redirected elsewhere. And I think we've proven and we've demonstrated that model. I mean, just in this past year alone, we've demonstrated a 440% growth rate, right? We've seen that while, yes, there are shrinking players in the kind of a home-based care model since 2020, what we've seen is actually a significantly increased volumes of patients. So the utilization has gone up, and I don't think it's redirecting patients. And again, this is not new to us. The New England Journal of Medicine published in the Insights Catalyst that the trend is similar in other parts of the world, including the US, but to name a few.
Rania, I love the way you put it, that this is more of a partnership and a collaboration. It's not taking away existing business from other players, because I think one of the points that Barry made earlier is that we do have scarce resources in South Africa. It's how you utilize it most effectively. I think going back to my initial point, we've got 85% of the population that we can still target, or that your companies can still target. So there's enough, I think, to go around for everyone.
No, absolutely. And we cannot do it alone. You know what I mean? Absent, for example, a progressive reform is what I'll call it, from a Discovery Health that says, for these 8 conditions across these plans, you must be admitted to hospital at home first before you go to a facility. There's no way that our models exist, right? And I think there's a learning there, even for our government, when it gets to some of these things. And we're starting to see a lot of that happening, even with the other schemes. And we are starting to realize that impact. Because the reality is that if you ask patients who are in hospitals, if I have to do something, what do you want? I mean, schemes have tried to find ways to kind of make the hospital experience better, whether it's introducing Netflix or iPads, etc. Like, patients don't necessarily want that. If you ask them what they want, they'll tell you to go home, right? They say they want to be home. That's all you think about. And so the sooner we can get them there, or the sooner we can treat them in a space where they want to be, and the more we can redirect sources to enhance the experience about treating patients where they want to be, the better the experience, the better the outcomes, the lower the cost.
Well, I think it's an important point to land here in the context of the NHI debate. In South Africa, we need more healthcare resources. We need more funding, we need more doctors, more nurses, more hospital beds, more capacity across the system. And we really got to take that mindset to this. It's got to be an additive effect here. We can fill all of the private hospital beds if we're able to get to a funding model that's great for Mark's business, it's great for Netcare, Mediclinic, and Life and the sort. So I think there's, in my view, as you put it, there is significant demand across the system. There's significant appetite for healthcare across the system, and need for healthcare across the system. If we're able to join forces, I think it becomes an attractive marketplace, and more importantly, an important value add to people across South Africa.
And I think one of the points I want to take out of Vuyani's sort of talk there was just around consumerism and potentially personalization of healthcare. So the customer, or the patient in this instant, that's asking for a better service. I think the majority of us around the table probably spend more time choosing what jacket to wear in the morning than they do on which hospital to go to, and they're not as sort of invested in that. Ron, what is your thinking from a discovery perspective? I know you've been using technology a lot to personalize the healthcare pathway. Could you talk us through some of the initiatives that you're thinking about?
Yeah, you're right. I think the healthcare consumer has changed. Healthcare consumers want healthcare in the palm of their hands, on their phone. They want it at home. They want it in a retail setting. You want to be able to go Clicks, a Discam, a MediRite, and so on and so forth. And they want it personalized. They want all of those things in one, because they're accustomed to that in other environments now. Everything is personalized, and it's challenging to personalize healthcare given the complexity of healthcare. The conditions are complex. Human beings are unique in many respects. The health system is complex. When to do what? What should you do this week? What should you do next month? They seem like simple questions, but in a healthcare context, they're not that easy to figure out. While I was 45 a few years ago, and now I'm pushing 50, what does that mean for me? And these are moving targets. So we've done a lot of work over the last year or so now on personalization of healthcare across Discovery Health. We have effectively, in very simple terms, we've taken the Discovery Health data set, 30 years of longitudinal claims data, GP claims, hospital claims, pathology claims, radiology claims, together with a range of electronic health records, and combined that healthcare data with vitality data. And vitality data gives you a different lens on the world. How many steps did you do this week? How many times did you go to gym? You're smiling. That's either good or bad. What are your eating patterns look like? Right now, these devices that many of us wear on our wrists tell us our heart rate and our stress levels, and how you slept last night, and so on and so forth. You take that data together with the healthcare data, you put it together, and you analyze it. Well, you can't analyze it You can't put it in an Excel spreadsheet or an Access database and figure out what the patterns and trends are. But what's happened now with machine learning and artificial intelligence, you can analyze it. And you can see patterns and trends that you never saw before. And you can create individual and personalized pathways, for unique people. And that's what we've done. So we've combined the data sets, we've applied machine learning and artificial intelligence across the data sets, and through that we've developed individualized personal pathways for each and every one of Discovery's 2.2 million adult members. So if you're a member of Discovery Health Medical Scheme, you will have an individualized healthcare pathway that tells you what are the 3 things you should be doing this week. Just 3 things to make it simple to digest. And that pathway is dynamic and updates and molds based on how your health progresses and your age progresses. So we're in quite an exciting phase. I mean, this is a great time to be alive, where you're able to move healthcare to the next horizon. And the next horizon is really personalization of healthcare.
Okay. Ron, I'm gonna, and probably Vuyani as well, I sort of know what Vuyani is going to say, but I'm going to ask a controversial question, but I suppose as CEO of Discovery Health now, you're used to controversial things. And we've got a few friends from the service delivery side of healthcare in the room today. But the argument around the private sector being over-serviced, what are your thoughts around that?
You're asking me that question.
Vuyani can come in as well.
Maybe we should ask. I mean, let me take a stab at that. I mean, I think over-servicing is a tough word, and there is a fine line between high quality and over-servicing. And I universally across South Africa's healthcare system, both public sector and private sector, we've got brilliant quality healthcare. And a brilliant set of doctors and nurses and allied healthcare professionals. And we must preserve the quality of that care. So, the first lens we apply as a funder on the system is, are we sure we're getting great quality? And you got to start there, and I think we've got to maintain that. I think the second lens on that is, are we getting quality at the right cost? So are we getting some level of efficiency on that? And we certainly see some level of inefficiency across the system. So what we do to monitor efficiency is we benchmark providers against each other, and we look for the outliers. Outlier hospitals, outlier doctors, outlier surgeons, outlier pharmacies, and we manage the outliers towards the mean as one layer of driving efficiency. I think a second layer of driving efficiency is we look for shared value partnerships, and we've got some great partnerships across our hospital providers and other providers where we say, look, if we're able to make an exchange for reducing the cost of care in a particular procedure or event, we'll be prepared to pay higher for other parts of the system. Or there are other rewards and incentives that manifest across the system. So I think you can achieve these win-win partnerships through what we label shared value agreements or value-based care contracting. So quality first, and then a range of efficiency levers, including value-based care that can be applied.
Got it. Rani, I saw you thinking quite deeply about that.
What he said. I think just to, I echo Ron's sentiments, right? I think there's a lot of inefficiency in the system. I think there's a significant misalignment of incentives. I think we try and, I think we're placing value in the wrong areas, where we drive kind of quantity over quality. And I think there's also further opportunity not to unlock value, but also find ways to reward people for unlocking value downstream, right? So it's not enough to just say, well, I have saved X and I'm delivering quality, where there are opportunities to then say, actually, given how I've managed my patient, I have then been more prudent in my pathology spend, right? I have done something different in how I choose to utilize radiology, right? I have been very focused in managing my patients, diabetes, that because of the fact that I'm encouraging, vaccination, plus the fact that I'm managing actively all the other components and therefore saving in hospitalizations costs, I think we need to find ways to reward people. And we've seen that doctors are capable, right? They know how to do that. But most importantly, other players in the healthcare system are capable of doing that. And I think there's a way, and I think there's an opportunity for us to do actually a review of where the alignment, where the incentives sit, and making sure that where value is created, value is rewarded. And I think we're slowly, we're slowly getting there.
Got it. I'm just going to probably ask one of the last questions and then open it up to the audience. Vuyani, you've obviously been on a journey from starting a company from scratch, looking for the funding behind it, and then growing that. Maybe first, from your point of view, just what the journey's been like in terms of getting funding for your business. Are South African investors au fait enough with the healthcare environment? And I'm sort of thinking about it it's a very traditional industry. There's a lot of big players that have been established for a long time. Just your journey on how it's been. And then I'll hand over to Ron after that to talk about how you guys think about innovation. Is it all internally developed? Do you look outside of discovery? But first to you, Vuyani.
The short answer is it's tough, right? Real talk. And I think it's particularly tough, it was and continues to be particularly tough because I'm a Black entrepreneur. Like, that's the reality, right, of building a business in South Africa. I was told that in order for you to be a successful entrepreneur, you need to be in the right networks, you need to have the right kind of education, you need to, plug into the right kind of spaces, and through that, you'll have that. Well, I got a medical degree from UCT, okay? Check. I'm a Rhodes Scholar. I went to Oxford. I've got access to, You've got all these things. And that is still not enough to, be able to get into the room. Or sometimes, it becomes very difficult to, even when you're in the room, you're not trusted. And I always say that in this country, Black entrepreneurs are given just enough to work a miracle, right? They say, well, here. And then when that business fails, it's because you've been incompetent. Right? Whereas my white counterparts, right? And I've got lots of friends who are white, who are entrepreneurs, half-baked idea, boom, here's 100 million rand. When that fails, it's like, it's the markets. No, you need a bit of time, right? And the reality is that, real talk, right? The reality is that in South Africa, unlike some of the other markets, right? Entrepreneurs, particularly Black entrepreneurs, are not backed. When you back someone, you factor in that actually it's going to fail. There's going to be a lot of uncertainty. They're going to miss, right? You put that in there. And if you do a survey, I'm not talking about the startups that are based in Stellenbosch or in other parts of Cape Town. I'm saying go around, right? Actually look at what's happening in the businesses. And I'm challenging this because, there are a few players here, and Ron, that these are the things that you guys need to kind of think about, right? Is that the experiences, and I'm glad Barry spoke about the fact that you've got a two-tier system. We also feel it acutely, even in the entrepreneurship space. That being said, I think there's been a lot of good, right? It goes without saying that Life Healthcare, it's common cause rather, that Life Healthcare is an investment in Cure Medical, right? There's been lots of moments. I've been fortunate enough to have the likes of Ron and Johnny at Discovery, who then say, hey guys, let's come in, let's see what this thing and where does that go, right? We've had people, for example, at MedScheme, who say, willing to transform, willing to try this out, right? If it is this hard for a guy who's got the networks, has got the right, education, heck, who even sounds like the right kind of guy who should be getting the cash, the rest of the other entrepreneurs stand no chance. Speaking about what we need to do from an economic perspective. And those are the realities. And I think often when entrepreneurs come into these spaces, we tend to be very apologetic, right? We tend to not speak up. We don't share about those experiences. And I think that if we are to transform the sector, and I'm speaking now for the other entrepreneurs, right? That if we are serious about backing entrepreneurs in this country, back them. Okay, like none of this crazy back them, right? And I think that we've got really smart, really dedicated people who can frankly transform this economy, but back them, right? So I think I've summarized it. It was hard. I think we're doing great as a business. I think we're growing. I think the players are softening up, and it's very exciting to be able to enter into rooms, be able to sit here with the CEO of Discovery Health and be able to talk about my business and what we've done over the time. But I am an outlier in this country. There are brilliant entrepreneurs out there. Back them.
Yeah. Boyani, I think from my perspective, you've been a very successful entrepreneur. I obviously deal with a lot of clients around the room here that are supremely interested in your business and love to invest in your business. And still, I can hear a bit of frustration in it. So I suppose that's the message that you want to get through, that, yes, I'm here now, but it is a tough journey to get.
No, absolutely. Right. And don't get me wrong. Like I always say to people, they always ask me, so between the PhD and the MBA, what do you use most in your business? And I tell them it's the PhD. Resilience. You spend time in the lab. Yeah. You fail, you try again. Yeah. You know what I mean? So, and that's the reality, right? And that's what you need. And so I think, and I always say to people, like, new level, new devil. Frankly, the funding part is the smallest part of what people need. Someone actually once said that Black entrepreneurs get advice, not capital. You know what I mean? They say, I'll mentor you. And that's the end. And I think there are ways in which we can actually plug people into a solid ecosystem, support great businesses, and help them get there. And so even for us, it continues. It continues to be, a challenge. But I'd be disingenuous if I didn't say that things are and things have and things continue to open up.
Ron, I'll hand over to you. I'm not sure if you remember what the question is that I asked you initially. But just around innovation and how you guys build it and think about it.
I thought we were going down a pathway where you were going to cut us a check now. I thought this was turning into a funding discussion.
Which we welcome.
Innovation. I think building on... so Discovery's ethos is we drive a lot of internal... firstly, it is constant innovation. Constant innovation. It feels like we're innovating all of the time. It's a lot of internally driven innovation. That being said, I think certainly where I get very excited is when entrepreneurs like this walk through my office, and I had an entrepreneur walk through my office this morning on quite an interesting solution as well. And we love to see new ideas. We love to see new entrepreneurs coming into the mix. It's the stuff that happens in garages that creates real magic. We know that. Discovery, in many respects, was built in a garage once upon a time as well. Right? That's the reality. And I think the organization understands that DNA. Adrian understands that DNA. By the way, it's Adrian's birthday today. For those of you who don't know, he turned 60 today. I said now I'm going a little bit off piste here. I said to him yesterday, wouldn't it have been ironic had the NHI been passed today? He didn't find it as funny. Anyway, I digress. The first part of our innovation is we like entrepreneurs. We look at external entrepreneurs. We look at internal entrepreneurs. All of the businesses within Discovery have actually been built by entrepreneurs. The insure business was built by an entrepreneur who had an idea. The bank business was built by an entrepreneur who had an idea. The UK business in the same fold. So we're wired towards entrepreneurship. We're attracted to entrepreneurs across the business. From an innovation DNA perspective, we're on a continuous innovation cycle. In fact, I can tell you, we aim on an annual basis. We put out a new product launch every year in September. We zone in and focus on that product launch. It happens across the health business, the bank business, insurance, so on and so forth. That keeps us on an innovation track. We're so invested in innovation that every Friday religiously, we have what we call an R&D session, where the senior most execs across the business sit in R&D for 4 hours on a Friday morning. Friday morning, I know tomorrow morning I will sit. My job is research and development, 4 hours alongside the team in our R&D lab, thinking about our new products and services. And that happens across all of the CEOs across the business. And I think that's pretty unique. CEOs who typically, be relatively hands-off in R&D and see what pops out the other side. We're hands-on in R&D. We're hands-on in innovation. Our innovation cycle does come with some downsides. It is high pace, lots of ideas, lots of stuff that ends up in the bin. That is our philosophy around innovation, is the more you're innovating, the higher the probability that something great's gonna drop out of the woodwork. And when we find something great, then we lock in and we invest and deliver. So I hope that gives you some of the flavor of Discovery's DNA around innovation and entrepreneurship.
Yeah, I think when we sometimes look at it from 30,000-foot view or whatever feet it is, you sometimes don't feel that enough is happening at the underlying, but the stories that you guys tell, the products that come out, show that there is actually a lot that's happening. So at the end of it, you look at it and suddenly the healthcare system has changed, but it's small changes that have happened along the way. Guys, I can't thank you enough. I think you've brought the passion, you've brought the innovation. I really respect both of you as individuals and both of you in terms of what you've brought to the healthcare sector. So thank you very much for your time. I'm going to open it up to any questions. I've got a lot more, but I think I'll leave the audience to ask some of the more difficult questions.